Dystonia, the word itself means abnormal movement, abnormal positioning of the muscle. In dystonia, this is the third most important medical disability problem. First, of course, essential tremors, Parkinson's, then the dystonia. Dystonia is of many types. It may be focal dystonia, it may be segmented dystonia, it may be generalized dystonia. The management and the overall prognosis of this dystonia, they also varies. Focal dystonia, when only one part, arm, hand, that may be involved, is called focal dystonia. But if two contiguous segments are involved, then it is called segmented dystonia. Like person got involvement of the eyelids involved, which is mostly blepharospasm, and they also have the facial muscle involvement. They may have the jaw and mandible involved, which is oromandibular dystonia, and these are segmented dystonia. Contiguous two segments are involved. In generalized dystonia, axial dystonia is very, very difficult to manage, and this is an important entity. Unlike Parkinsonism, which is mostly after 60 years, but dystonia can occur any age group. In infancy part also dystonia can occur, particularly after birth asphyxia, and certain hereditary problems that can also occur in early part also there, and it may be very, very disabling there. As the management part of dystonia is concerned, it's a holistic approach is mostly preferred, where you give many things are involved in that one. And medication management part, most of dystonia, they respond to triaxophenadil and the other benzodiazepine preparations are used for that. And many dystonia, they do respond. But when dystonia becomes disabling, then surgical treatment indicated there. In surgical treatment also, we got rhizotomy, other can also be done, which also not much used now, and they are now replaced by DBS. DBS offers a better opportunity, better management, better quality of life, and better everything else. So the cost factor, of course, I told you the initial cost factor may be high, but if you overall look at the cost, in the long run, this cost is not that very expensive there. And moreover, in dystonia, as the DBS is a reversible therapy, and as for put a position of rhizotomy, can be something done, and which is not reversible. And here, DBS therapy that is reversible. And here, this pacemaker, just like pacemaker in the heart, the pacemaker put, and they put below the clavicle, and the pacing is done, and it manages from there. Dystonia, as far as the stimulation part is concerned, that will be talked by Dr. Preetham, and you can stimulate some part of thalamus, which has got connection to the globus pallidus, and that's important, and where it can be managed. And prognosis is very, very good, and best part is reversible. Of course, you always start with the medical management at the beginning there. The certain drugs can be used. Holistic approach also important factor, and offending factor. So many of the people, they have the toxic factors, they may have the medication which is responsible for dystonia, their removal, and of the cause which is responsible. Certain, as Wilson disease is concerned, you start treating the Wilson disease, dystonia itself getting corrected there. But if those factors are not there, as idiopathic dystonia particularly, and they are the ones which benefit the most by the DBS therapy. Thank you.